A new survey of Cleveland Clinic patients suggests that trauma is both highly prevalent and underaddressed in chronic pain care, leaving many patients without treatment that meaningfully addresses the intersection between traumatic experiences and chronic pain. Researchers say the findings point to a significant gap in clinical practice and an opportunity for health systems to integrate trauma-responsive approaches into routine pain management. The Quality Improvement Study, published in the September 2025 issue of Pain Medicine, analyzed responses from 702 adults with chronic primary pain who completed an anonymous electronic survey in 2022 and 2023. Although all respondents had been treated recently for pain through primary care, pain management, physical therapy, or chiropractic care, the majority reported experiences that extended far beyond physical symptoms. According to the study, 68.2% of patients said they had experienced at least one traumatic event, and almost 1 in 5 reported both trauma exposure and clinically significant trauma symptoms. Previous research has shown that pain and trauma tend to intensify each other, but what stood out in our data is just how common trauma is among patients seeking pain care, explains lead author Hallie Tonka, PhD, a psychologist in the Center for Wellness Research and Training at Cleveland Clinic. Despite this, pain clinics are not consistently screening for trauma or connecting patients with treatments that address both conditions. A comprehensive chronic pain program should address physical, mental, and emotional needs. This is key in the healing process. Science now confirms what many have long felt. The body keeps the score of every stress it has endured. Each worry, heartbreak, or unresolved fear leaves traces not just in memory but in muscles, hormones, and the nervous system itself. Over time, the body adapts to survival mode, staying alert even when no real threat remains. Thinking alone cannot switch that off. Researchers studying trauma and chronic stress found that the autonomic nervous system plays a central role in this process. When under repeated pressure, the body floods itself with cortisol and adrenaline, keeping heart rate and alertness high. Eventually, this state becomes the new normal, leading to exhaustion, anxiety, inflammation, and poor immune function. Therapists and neuroscientists emphasize that healing stress isn't intellectual, it's physiological. Stress has an effect on our body. It affects our autonomic nervous system and can increase pain too. True calm isn't achieved through overanalyzing emotions. It's restored by teaching the body that it no longer needs to fight to survive. This is why holistic-centered treatment takes a whole-body approach to treating CRPS and complex chronic pain. This just emphasizes the importance treat addressing all aspects of chronic pain, physically, mentally, and emotionally, all while individualizing the treatment to each person's specific needs and goals. Holistic-centered treatment is transforming lives and introducing chronic pain patients to a new way of healing. Contact us to learn more and to schedule a free consultation. 8449-940-999